Hello viewers, welcome to this session on stroke. I'm Dr. Renjen, Senior Neurologist at the Indraprastha Apollo Hospitals, New Delhi, and who looks after the stroke services at the hospital. Today, I'm going to tell you about cerebral stroke. In this, I would cover who is at risk of stroke, what is a stroke, what are the causes of stroke, how can we prevent stroke, and how can we treat stroke. Stroke can affect anyone of any age, although some people are at a higher risk than others. Because anyone can have a stroke, it is important for everyone to be aware of the risk factors of stroke. Stroke is the third highest cause of death and, importantly, the leading cause of severe disability. But many of these strokes can be avoided if everyone takes steps to tackle the main risk factors. A stroke happens when the blood supply to the brain is disrupted. Most strokes occur when a blood clot blocks an artery which is carrying blood to the brain. Some strokes are also caused by bleeding within or around the brain from a burst blood vessel. If a bleeding occurs inside the brain, it's called intracerebral hemorrhage. If a bleeding occurs in the coverings of the brain, it is called a subarachnoid hemorrhage, and both these conditions are of paramount importance because the treatment modalities differ in both of them. Some strokes are fatal, while others cause impairment of temporary disability. The most common effects of stroke are paralysis of one side of the body, loss of ability to speak, read or write. At the moment, there is no treatment which can cure a stroke once it has occurred. This makes it especially important to take steps to reduce your chances of having a stroke in the first place. Now I will tell you what can we do to reduce your chances of having a stroke. Factors which increase the risk of stroke fall into three main groups. 1. Those which you can do something about. Those factors which your doctors can do something about. Those which cannot be changed, but if they apply to you, it is particularly important to do something about the risk factors which can be tackled. Now coming to the risk factor which you can do something about, the risk factors which you can modulate and decrease the chances of stroke. These factors are the modifiable risk factors of stroke, which would imply smoking, lack of physical exercise, drinking too much of alcohol, and eating an unhealthy life, or leading an unhealthy life and eating an unhealthy diet. Risk factors which you can do something with the help of your doctor. These factors are high blood pressure, and if you had had a past history of a minor attack, heart disease, a very common cause in the elderly called atrial fibrillation, which would mean irregularity of the heartbeat, diabetes, and taking the oral contraceptive pills. There are certain risk factors which you and I can do nothing about. Older people are at a higher risk for stroke. There is nothing you can do about getting old. People of the Asian or Afro-Caribbean region are also at the higher risk of strokes. People who have a strong family history or people who have a genetic predisposition have a higher chances of having a stroke. So listeners, you would appreciate even though there are some factors which you cannot modulate, you cannot do anything about, but it becomes more important that people who have these factors to please look after and take treatment for the modifiable risk factors of stroke. The factors which do not increase the risk of stroke, which I would like to stress about, but there are a lot of misconceptions about stroke. It is helpful to clear about factors which are not associated with strokes. Strokes are not caused by stress. Strokes are not caused by exercise or sexual intercourse. In fact, regular exercise can lower blood pressure and reduce the risks of stroke. Listeners, I would now very shortly cover these risk factors which you can do something about. And the most important risk factor which I would like to stress is smoking. Smoking increases the risk of a wide range of illnesses, and stroke is no exception. Smokers run at least double the risk of stroke compared to non-smokers. How does it cause a stroke? Smoking causes furring in the arteries, which is called atherosclerosis, and the blood is likely to get clotted and clot formations occur in the brain. Both of these increase the risk of stroke. What can you do to reduce the risk of stroke? The only thing a smoker can do to reduce the risk of stroke is to stop smoking and avoid being a passive smoker. Lack of physical exercise. There is a strong evidence to suggest that people who are physically inactive run more than double the risk of stroke as compared to people who keep moderately active life. How does it cause a stroke? Being physically active over long periods is linked to high blood pressure, the cause of many strokes. Don't feel discouraged if half an hour session sometimes is a doctoring target. Any exercise is better than no exercise. If you can exercise or run or walk for half an hour, 4 or 5 times a week is enough to keep stroke away. Drinking too much of alcohol. Going on a drinking binge is a risk factor, increasing the chance of stroke 5-fold. Regular heavy drinking also increases the risk of stroke. How does it do? Drinking a great deal of alcohol at once raises your blood pressure to extremely high levels. This increases the risk of a blood vessel bursting and bleeding in the brain. Drinking too much on a regular basis can also raise blood pressure and increases the chances of stroke. Last but most important, eating too much salt and fatty foods. Eating large amounts of salt and fatty food increase the risk of stroke. Just as a poor diet can increase the chances of stroke, there is now evidence that eating healthy food can actually reduce the risk of stroke. Researchers have shown all over the world that eating a diet rich in fruits and vegetables can protect against strokes. One large study found that people who ate fresh foods daily benefit them by reducing the risk of fatal stroke by 1/3. Risk factors which you can do something with your doctor. High blood pressure. High blood pressure or hypertension is one of the greatest risk factors of stroke. I'm stressing on the fact the greatest risk factors of stroke. People with high blood pressure have up to 7 times greater chances of having a stroke than those with low blood pressure or normal blood pressure. Failure to detect hypertension is the #1 cause of avoidable strokes. For every 10 people who die of stroke, 4 could have been saved if they had regular blood pressure checks and followed their doctor advice to bring their blood pressure down. My advice, listeners, please accept the fact that you have blood pressure. And if you have blood pressure, you need to be treated. And if you treat your blood pressure, you substantially decreases the chances of your having a cerebral stroke. What can you do to reduce your risk? Have your blood pressure regularly checked. Keep your blood pressure normal. Do regular physical exercise and avoid eating salt and fatty foods. It's very important to make changes in your lifestyle. Avoid being overweight. Reduce the amount of salt intake in your diet. Drink sensibly. Give up smoking. Take regular exercise. Are the backbone of avoiding a stroke. I must stress upon that fact that you should not forget or you should not ignore minor symptoms of stroke which may come to you. These symptoms at times are so transitory, could last for half an hour to 1 hour, which could consist of a weakness of one half of the body, difficulty in speaking, difficulty in walking, clumsy gait, difficulty in vision, seeing a double vision are all symptoms of an impending stroke. This, listeners, is called a transient ischemic attack, and the terminology which I tell my patients that this is an angina of the brain. So if you get an angina of the brain, like for your angina of the heart, you run to your cardiologist. Please run to your neurologist and take his opinion to find out what measures you could take to see that these angina of the brain does not get converted into a total stroke. Heart disease is extremely important, and heart disease could be associated with stroke. The most important thing is atrial fibrillation, which is an irregular heartbeat, which can be easily diagnosed even by a plain, simple ECG. And if you treat your atrial fibrillation, you decrease your chances of having a stroke. Diabetes is the dreaded risk factors of stroke. How does it cause a stroke? People with diabetes tend to suffer from high blood pressure. They cause atherosclerosis. Both increase the likelihood of having a stroke. For women, intake of oral contraceptives increases the chances of having a stroke. So listeners, how do you reduce your chances of stroke? Modulation of lifestyle, decreasing the risk factors of stroke. The risk factors where you have a control of them, and the risk factors where you need to go to your doctor so that he controls your risk factors. Unfortunately, listeners, if you have a stroke, as I always say, stroke is an emergency. Stroke should be immediately looked into. You should immediately run to a hospital as early as possible. Now we have agents which are called the clot busters. Even if you come to us 6 hours, 7 hours, 8 hours after stroke, we can give you clot busters, or we can mechanically remove your clot. Even if you have had a hemorrhage in the brain, still run to the hospital. You could be you should be helped out with your intracerebral hemorrhage or a subarachnoid hemorrhage. In the end, I would end by saying that to make you aware what are the symptoms and signs of stroke, please remember these symptoms and signs. The most important and the simplest is FAST. F-A-S-T. If the facial or the face deviates to one side, there is an arm which comes down to one side, there is a speech problem, time is brain. Run to your near hospital and take medical aid. Thank you very much for a patient hearing.